This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Nasocobal 250mcg Nasal Spray is a vitamin B12 supplement. It is designed for adults dealing with specific vitamin deficiencies. Indications and uses. This nasal spray is indicated for maintaining vitamin B12 levels in adults with pernicious anemia who are in remission after intramuscular therapy. It also addresses vitamin B12 deficiencies due to dietary issues, drug interactions, or malabsorption conditions, ensuring that individuals receive the necessary supplementation to support their overall health. How it works. The nasal spray works by increasing and restoring vitamin B12 levels in the bloodstream, which is vital for blood cell production and managing deficiencies. Directions for use. For optimal results, use as advised by a healthcare provider. Before application, gently blow your nose to clear both nostrils. Hold the spray with your thumb at the bottom and your index and middle fingers on either side of the nozzle. Close one nostril, insert the nozzle into the other nostril, and tilt your head slightly forward. Breathe in gently while pressing the plunger firmly upwards, and maintain the head position for 10 to 20 seconds to allow proper absorption. Possible side effects. Common side effects include headaches, weakness, inflamed or swollen tongue, burning or prickling sensations in the limbs, nausea, and stuffy nose. Consult a healthcare provider if these symptoms worsen. Precautions and warnings. This medication should be used with caution in pregnant or breastfeeding women, individuals with liver or kidney issues, and those with known allergies to its components. It is important to consult a doctor before use to ensure safety and efficacy. FAQs. 1. What is the purpose of this nasal spray? It is used for maintaining vitamin B12 levels in individuals with pernicious anemia and vitamin deficiencies. 2. How should it be administered? Follow your physician's instructions for intranasal use. 3. What side effects might occur? Possible side effects include headaches and nausea, among others. 4. Is it safe during pregnancy? Use during pregnancy should be discussed with a doctor. Thank you for watching. If you have any questions or suggestions, please leave a comment below. We appreciate your feedback.